While we have seen the COVID numbers continuing to rise daily across the Gem State, 11,000 confirmed cases since March, more than 300 a day since July 3rd. Nearly 130 right now in the hospital with COVID and more than 30 of them in the ICU. And we're just getting numbers right now that just today we've seen 727 new confirmed or new cases of COVID-19 and 7 more deaths added to the tally. But there's a better way to tell this story than just regurgitating these numbers. We know those numbers represent people. And one of those people who used to be part of the state ICU tally, at least until July 3rd, is Olivia Estrada of Nampa. More numbers for you. Olivia is a 36-year-old mother of 4 who says she started feeling feverish on June 20th, the day before Father's Day. So she went to get tested. 3 days later, she got the phone call to say she had COVID-19. 4 days after that, Olivia says she couldn't catch her breath. And the monitor she was wearing on her finger that told her her oxygen level, well, that number was falling. So Olivia made the call, first to her mom, then to take herself to the hospital.
I was like trying to talk to my mom on the phone. I told my mom I don't feel good. And she could hear it in my voice. I can't breathe, Mom. I can't talk, I can't breathe. And I feel like, I said, I want to pass out. And she's just like, don't, like, she didn't want me to drive myself, but I was like, I have to go, Mom. And I got in my car, no shoes, nothing. And I got in my car and I got to the hospital. And by that time, I'm cold, but I'm hot, you know, and I jumped off and I told the lady, please, I need help. I need help. I feel like I'm dying. I threw my keys, I towed my car, and then I just collapsed. I didn't know how long I was there at the hospital. My mom said it was 4 hours. And honestly, this is what I had a dream that my grandma was pulling me out of water. And but when I came up out of the water, I heard sirens. My eyes are open, and I see my grandma nowhere. And I'm freaking out, and I'm in the ambulance. And I'm like, holy crap, screaming, crying. And they're like, she's alive, she's alive. They're alive, ma'am, who are you? And I'm like, they call me Oli. Where I need to move my car.
Why were you in the ambulance?
Because they rushed me to the ICU in Boise.
You say they were surprised you were alive?
Yeah, the lady was like, you're alive, because I stopped breathing. I stopped breathing, and I remember they were giving me oxygen, and I was just like trying to take it, move. And she's like, no, just stop, please. And they put my hands down, and I just realized, like, holy, like I'm in the ambulance, and I get rushed to the ICU. She told me, I'm freaking out because I'm like, what am I doing here? Like, what the? But I needed to be isolated. They isolated me, and I stayed in there for 6 days.
Were you conscious the whole time?
I woke up like the second day. It was like, because I didn't know how long I had been there. The doctor came in. He said it was my second day there. He's like, you're here. He's like, you've been here 2 days now. And how you feeling? I said, I'm in pain. So I'm in pain really bad. I can't sleep. Like that's when I slept until like the second day, and that's when I started feeling it in my body. You know, like my body was hurting so bad.
When were you the most scared?
The day I woke up in the hospital. I was scared. Honestly, I was scared because I'm used to my mom there comforting me. You know, like my family couldn't go up, nobody could go up. I was by myself. I was crying, just like, what am I doing here? Like, I couldn't believe it.
When you were told on that Tuesday that you had COVID, between then and that Saturday that you took yourself to the hospital, how did you think this was going to play out?
Go like a regular cold, like a regular flu. You know, like you get your flu symptoms, you take medicine, and you get your body better, and that's it.
This whole thing turned just like that.
Yeah, it did. It really did, because I thought I was going to get better, because I've seen people just not have to get hospitalized, and my body couldn't take it. I'm thinking I'm so healthy, and I wasn't at all.
What's the biggest thing you probably learned from this, you think?
Man, if I would have known that it was gonna hit me like this, I probably wouldn't been so careless. But then again, as deadly as this coronavirus is, it saved my life. It saved my life, honestly, because I was in a bad spot. I'm not gonna come in here lying like I was like, no, I was in a bad spot, and it saved my life. The virus saved my life. At the end of the day, I can't walk good, and I can't, I'm not pushing myself so hard. My mom and them are like, rest, Olivia. I'm not used to resting. I'm an active person, pretty much, kind of active. Just talking like this. I'm feeling a little like, little hot, little out of breath. But I mean, to be able to tell my story, to be able to tell people that how important it is. It means more to me. And, you know, I'll sacrifice these little breaths that I'm taking now, you know, just so people can hear that it is important. It is important, you know. Now I'm telling people, wear a mask, like wear a mask.
Olivia has been home since July 3rd, and she says she stopped getting headaches just about a couple of days ago. You heard Olivia say she was in a bad spot when this all hit her. And she told us today she was a meth user until June 22nd, the day before she found out she had COVID-19. And nearly dying from the virus, she says, has taught her to not take life for granted anymore. So it has changed her life in more ways than one. And I know you can say, well, no wonder her immune system was compromised. But as Olivia told us, she's never been in the ICU for 6 days from the flu.